Hi, everyone. We are discussing prenatal development and normal routine pregnancy. The next class will go into high-risk conditions of pregnancy, but we're really just going to learn about normal, and there's still a lot. So by the end of this unit, you should be able to identify the 3 stages of prenatal development, and that would be pre-embryonic, embryonic, and fetal, and the key events that occur in each phase. You should be able to describe the development and functions of the placenta and umbilical cord briefly. List the physiologic changes in pregnancy, and that's a little bit involved because every system in the body changes with pregnancy. Identify normal discomforts of pregnancy and promote self-care to relieve them, and describe what high-quality prenatal care looks like. So we're going to start with prenatal development. The first 8 weeks is the pre-embryonic stage and the embryonic stage. In the pre-embryonic stage, we have a fertilized ovum. As the cells divide, it becomes a morula, which is a mass of cells, about 6 to 12 cells, and then it becomes a blastocyst where the cells start to differentiate. And then it enters the uterus and implants. At this stage, it is not considered susceptible to harmful agents called teratogens. After that first week, in weeks 2 through 8, we enter the embryonic stage. All organs are formed by the end of week 8. You'll see I've highlighted that and put some exclamation points, and that's because this is when the fetus, all the structures start to develop and become what they should be. Implantation occurs by the end of week 2. It really begins at about day 7 or 8 and then becomes complete. The first structures to develop are the heart. It starts as a tubular organ, and then the 4 chambers develop, and then it starts to beat at about day 22. And the neural tube. So the neural tube also starts as a very crude structure and then differentiates into the spinal cord and structures in the brain. It starts to fuse at the center, and the heart begins to beat in week 3. This is very early in fetal development. Development then goes from head to toe and proximal to distal. So it will begin in the middle and go out towards the ends. The limbs are the last to develop, particularly the feet. This is when, if something is going to go wrong, it typically does when we see big structural malformations. And so we want to protect mom from teratogens. Now, some moms might not know they're pregnant. Some moms might know very early, but not know how to avoid exposure. So this is when preconceptual care and education of women of childbearing age should begin to happen before they even think of having a pregnancy. And there is a list of teratogens that you can access if you just click on the link that's in your Google Slides. A teratogen is any agent that disrupts growth and development in an embryo or fetus and causes anomalies. Damage occurs during critical periods of development. So in other words, for example, cleft lip and palate are usually between weeks 7 and 9. The neural tube is usually between weeks 3 and 5. Heart also between weeks 3 and 5. Epigenetic factors, which means that mom has a genetic predisposition to the agent, are usually kind of important. And you can see a list of common teratogens there. There's a little picture. For example, radiation can interfere with normal development, alcohol, drugs, certain hormones, thyroid hormone, cigarettes, German measles, lead, mercury, conditions like diabetes, high glucose levels, medications that mom might be taking, particularly your anticonvulsants and a few others, but you can check out that list. And here's what development looks like. So there's your morula, that mass of 6 to 12 cells. There's the blastocyst. It separates, and you don't really need to memorize this, into 3 layers: the endoderm, the mesoderm, and the ectoderm. And those will become all the different structures of the body. And now here we have an embryo, and the embryo becomes more human looking as time goes on. By 8 weeks, it will look more like a human. Then from weeks 9 to weeks 40 or more, we have the fetal stage. At this point, we can call this developing baby a fetus. All organ systems are already present. They will refine, they will mature, they will develop their functioning. In weeks 9 through 12, Fetal movement begins. It's not felt by the mom until about week 16 through 20. So make a note there. The kidneys begin to function, and genitalia are fully differentiated by 12 weeks. If you have a really good high definition ultrasound, you can see gender. It is more common to see it around week 16 through 20 with normal technology, but you could see it at week 12. In weeks 13 through 16, the female will have all the eggs she's going to have. They are not mature, but they are there. You can see blood vessels under the skin. You'll see fingers, fingerprints, and toe prints. By week 20, the fetus is swallowing. Insulin production at this point begins. So the baby will regulate its own glucose. And lanugo is this really fine, downy hair that covers the body. Vernix caseosa is this cheesy white stuff that covers the body, and these are protective against amniotic fluid. By week 24, the lungs begin to form surfactant. Surfactant is a chemical that helps the alveoli stay open, and that's important for being able to breathe. At this point, surfactant is not sufficient. Most of the time, if a baby were born at 24 weeks, all of the time, if a baby is born at 24 weeks, then we're doing a resuscitation. Up to about 34 weeks, they will have to administer surfactant into the trachea to get to the lungs to open up those alveoli. They'll also use like an oxygen mask and apply CPAP to help open up those alveoli so they're not sticking together. You can get good gas exchange on the outside. And we're going to talk about a term called viability. So the fetus can survive with intensive care, maybe, at 23 weeks. Survival rates are not high. It's about 50-50. Intact survival or survival without lasting deficit is very low at 23 weeks. It gets better every single week. And that's a concept that we'll talk about more when we talk about preterm labor and when we talk about the high-risk neonate. But just remember, viability starts at about 23 weeks. There are some sources that suggest that at 22 weeks we may have viability, but the statistics are absolutely dismal on this. Okay, so there's your fetus. And you can see there's the baby, looks more or less human. All the features are there. They're going to be fine. They're going to grow. We have an umbilical cord. We'll talk about that. And we have the placenta. So third trimester, by the 28th week, usually the testes descend. Sometimes they take a little longer. The fetus tries to move to a head down position for birth, and blood is produced in the bone marrow. In weeks 29 to 34, we have subcutaneous fat. And there's something called variability of the fetal heart rate, which is a concept we'll discover more in labor when we talk about fetal heart rate monitoring. But the central nervous system starts to mature, starts to be able to accelerate the heart rate or decelerate the heart rate in response to conditions in utero. In weeks 33 to 38, vision is not great. The baby sees best if it's born at a distance, kind of cool, from the crook of mom's elbow to her face or dad's elbow. You can see vernix in the skin creases, and the lanugo starts to disappear. So that's the mark of maturity. Lungs and central nervous system continue to mature all the way up to 40 weeks. There's a campaign now with the March of Dimes, Go the Full 40, trying to convince moms not to induce early because brain and lungs still mature even at 37, 38 weeks, and the fetus continues to grow and gain weight. Now we have placenta, is a temporary organ meant to perfuse the baby. It is a circulatory interface. So there's a mom side and there's a baby side. It's between mom and fetus. No mixing of blood actually occurs. Maternal blood does not get into the circulation. It goes into the blood vessels. It's filtered. And the things the baby needs go to it, along sometimes with things we don't want the baby to get. There are these finger-like projections known as chorionic villi, where the blastocyst implanted, and that attaches the placenta. And there are three functions of the placenta: circulation, so it acts as the fetal lungs and heart. It's gets the oxygenated blood to the baby. It protects the fetus from some organisms. Some things are, or organisms and substances. Some are too big to get through the placenta. Some are small enough to get through anyway, and that's where your teratogens come in. And it secretes hormones that support the pregnancy. So estriol, which is a form of estrogen, HCG, or human chorionic gonadotropin. That's the chemical that turns your pregnancy test positive when it's detected in the urine. And progesterone. Progesterone is the pregnancy hormone. It slows down smooth muscle. It encourages the growth and development of the uterine muscle and the lining. And progesterone has effects on other parts of the body, but it is secreted by the placenta at a certain point in pregnancy. Remember that the placenta is like the fetal lungs. So anything that compromises the placenta is going to give you impaired gas exchange. And there's a picture of the placenta. You can see, if you see my pointer here, that is the fetal side. We call it shiny Schultz. And that is the maternal side. We call it dirty Duncan. It has all the little lobes and stuff. It kind of looks, when it comes out, if you see a delivery and you see the placenta after the delivery, this part of it kind of looks like a tree. So they call it the tree of life. If it comes out the right way, it's going to come out shiny Schultz first, which means it all came out in one piece. If you start seeing dirty Duncan or the maternal side, that's a sign that things may be left behind. So you want to be careful of that. You don't have to remember that for now. Just know that that's what a placenta looks like. Other structures that support the baby, we have the umbilical cord. It comes from the fetal side of the placenta, as you saw. It's a conduit. It's a big blood vessel. It's a big, like, highway, interstate highway with 3 blood vessels normally that travel to and from the embryo or fetus. It contains 1 large vein and 2 smaller arteries. The vein, it's the opposite of what you see in adult circulation or extrauterine circulation. The vein actually carries the oxygenated blood to the embryo or fetus. The arteries carry the deoxygenated blood to the placenta. You're trying to get rid of all of those waste products through the arteries. And I'll try and get a picture of that for you guys for class. The vein is sort of big and floppy. It's real easy to find. And the 2 small arteries look like little pinpoints. And they have lots of smooth muscle that propel the blood back to mom. The umbilical cord is covered in Wharton's jelly. It's this clear jelly. Helps support and protect vessels when the placenta is delivered. The umbilical cord, the Wharton's jelly will dry out and constrict the blood vessels in the umbilical cord, and that'll sort of get that natural process of going from fetus to newborn. We usually clamp it and cut it. But the cord usually looks a little twisted because baby likes to play jump rope in there. Sometimes you'll see fun features like a nuchal cord. Usually happens early in pregnancy. It's loosely looped around the baby's neck. It can get tighter as the baby grows, and that'll cause changes in the fetal heart rate if it gets too tight during labor. You might even see what's called a true knot, which is really kind of freaky to look at, where the cord is tied into a knot. We always call those kids lucky. It's surprising how many of them do okay. And that is it for prenatal development.